For those of you planning on having abdominal or pelvic surgery, learning to breathe well beforehand can make a big difference in your recovery. Breathing is important because surgery often results in deconditioning, and it helps your abdominal and pelvic muscles fire better after the surgery, improves your digestion, and stimulates blood flow to help you heal. We're going to do an exercise called 360-degree breathing right now. And you're going to place your hands on the sides of your rib cage. So your thumb is in the back and the fingers are in the front. And as you inhale, you're thinking about expanding your rib cage in that 360 degrees. So try it with me. And then just exhale and let your rib cage come back in. As you do this, you want to try to minimize breathing into your upper chest, and you want to expand into the back as well as the sides. The back should expand almost as much as the front. Getting your body strong before surgery is important also because you often get deconditioned when you're out of commission for a little while. Total body strengthening is useful, so grab your nearest weight or resistance band or whatever you want to do and work on your hips, your abs, your shoulders, your back, your legs, anything that you can work these big muscle groups so that you will have a better recovery afterwards.
So managing your bowels after surgery is super important because surgery tends to put you at risk for constipation. Between the anesthesia, pain medications, and just the shock to the area after having an abdominal and pelvic surgery tends to really slow things down and make things really uncomfortable after the surgery. You want to avoid straining after you've had an abdominal or pelvic surgery because it is not going to work out well for you. So a couple of things you can do to avoid that constipation is actually take a laxative before you go into surgery and then continue after surgery. You can also try a couple of deep breathing techniques on the toilet to avoid straining. So thinking about inhaling into the lower part of your rib cage here and expanding into the pelvis and then exhaling. You can try exhaling with some low vocalizations like mooing like a cow or just like a deeper like hum, like a hmm, and you'll actually feel your pelvic floor lengthen a little bit when you do that. Getting a squatty potty or a stool under your feet can be really helpful as well. And just make sure that you're taking your time, giving yourself the time you need to empty your bowels completely.
Splinting can be super useful after you've had surgery, especially to protect yourself and protect your stitches so they don't come open, and exert force through your body without damaging any of your surgical intervention. If you find yourself needing to cough or sneeze or get out of bed or do anything forceful in that way, you can use your hands, but a pillow is also useful. You can place this around your abdomen, and so it just kind of give yourself a hug with the pillow. And if you need to cough or sneeze, you cough and squeeze the pillow at the same time. You can do this with your abdomen. You can also do this with your perineum. So you may need to splint in both places depending on the type of surgery that you've had.